More patients and colleagues began to reach out to me at the beginning of the pandemic to find out what natural remedies could be useful for COVID-19. And I suggested remedies that had been effective for other viral infections, such as influenza or pneumonia. The whole idea of natural therapy is that we believe that if something is effective for one condition, we can try it for a related condition. It turns out that COVID-19 is a SARS infection, and actually herbal medicine was shown to be helpful as a preventive measure. That is, if you really got SARS or COVID-19, you should really seek medical attention. But the point is that herbs and other natural therapies could help prevent severe infections and could also help people recover from their infections. So basically, people were calling me about COVID-19, but I was recommending things that would work for influenza, pneumonia, and also the first SARS. And then in 2020, I became aware of one of my colleagues who said he developed long COVID.
It's estimated that 1 in 5 adults who have had COVID-19 suffer from long COVID months, even years after being infected.
The government estimates as many as 7 to 23 million people are affected by long COVID, and a Census Bureau survey suggests that among people who have been infected, 1 in 5 are still experiencing lingering symptoms.
And I said, I think I've heard of that. I said, isn't that like chronic fatigue syndrome? And we discussed remedies and natural therapies that he could use for his long COVID situation that also responded to chronic fatigue syndrome. Following an abdominal surgery, so I was in the hospital during COVID, I had a 5-hour abdominal surgery. And after that surgery, I had signs of long COVID and chronic fatigue syndrome. I was very tired. I had brain fog. And one thing was particularly interesting is that initially, as soon as I was out of the hospital, my day pretty much ended at noon. You know, I had no energy to do anything the rest of the day. And gradually, I had more energy, so my day ended at 5 instead of at noon. And time went on, and all of a sudden, I developed these excruciating headaches, and I couldn't really even, raise my head above being in bed for 5 days. That's how bad the headache was. And I took several COVID-19 tests, and they were all negative. Later, when I saw a doctor, physician, they said, "Oh, I think you had viral meningitis." And I said, "Meningitis?" I said, "Isn't that fatal?" And he said, "No, the bacterial kind is fatal, but the viral kind is not." About 7 months after that initial infection, I ended up in the hospital in the emergency room. I felt like I had a 5-pound weight on my chest for about a couple of days, and also had this suffocating feeling in my throat. And I thought, maybe I'm having a heart attack. Bottom line is I went to the emergency room, and the young EKG technician goes, "Wow, your EKG, it doesn't get any better than this." And I go, "Well, that's good. At least I'm not having a heart attack." And then later the doctor came in and he asked me some questions. And he says, "I think you have chronic fatigue syndrome." I said I thought I had a post-viral infection. And this is the kicker. He said, "I think you should see a rheumatologist." And I think to myself, a rheumatologist? A joint doctor? For something complex like chronic fatigue syndrome? Are you kidding me? And then a nurse later told me, "Well, the doctor can only refer to people in his network." That means if you go to a Western physician, private or HMO in a hospital, they can't refer you to a natural therapist because they're not in their network. And in my situation, I thought that was outrageous because I was in a public hospital. In a public hospital, the doctor should refer you to whoever can do the job the best. But no, I got a referral to a rheumatologist. And the point I'm trying to make is that these conditions like chronic fatigue syndrome and fibromyalgia are complex conditions. They do not get better by 15-minute or 5-minute medical visits, right? And so part of my motivation, strong motivation for making this movie is I want people to know whether you have long COVID, chronic fatigue syndrome, fibromyalgia, or another post-infectious illness, that there is hope through natural medicine.
3, Andrew, take 1, Mark.
Hi, I'm Andrew Gaeddert, Herbalist and Director of the Get Well Foundation. When I was 19, I almost died of Crohn's disease, an inflammatory bowel disorder. As pharmaceuticals couldn't help me, I began to search for other alternatives, and they included herbs, nutrition, and Chinese medicine. And later I founded a company, a clinic, and an advisory service to help other people. I wrote a few books, including Healing Digestive Disorders, and many of these colleagues and former patients, well, they reached out to me because they realized that Western medicine was not a good option for either chronic fatigue syndrome or long COVID. And that's because these diseases are very complex. So a doctor treating long COVID might see one patient and they come in and they say, "Oh, doc, I've been dealing with gastrointestinal pain for months." And then somebody else might say, "Well, I have excruciating headaches." And then another patient might say, "You know, my chest feels like it's going to explode. I can hardly breathe." And the formal diagnosis of all three of these patients is long COVID. And so what doctors really like to do is discover one disease and invent one drug. One disease, one drug. And so they really don't like to treat things like long COVID. I mean, I want a drug for long COVID, not to see all these complex patients with all these different symptoms. That's really hard. And if there's not an acupuncturist, an herbalist, or an integrative physician in their network, they're never going to make that referral. So people have to go to herbalists, naturopaths, and integrative physician clinics in order to get help. But the bottom line is that this is the strength of natural medicine. We look at the individual with the disease, not the disease. So the difference is a Western doctor will say, "You have long COVID. I'm going to search for the one pill that treats your long COVID." A natural doctor will say, "Let's look at your symptoms and why you have this condition, and are there diet and lifestyle factors which cause you to have these symptoms?" Now, one of the things that I've learned in clinical practice for 35 years is really the importance of a stress reduction and exercise practice. And so one of the most important things to remember when we're treating chronic fatigue syndrome and long COVID is it's so important to have stress reduction techniques that work. And this could be prayer, or it could be meditation, it could be yoga. Things that reduce stress are very, very important. And important take-home message on exercise: if you're recovering from chronic fatigue syndrome, long COVID, or fibromyalgia, you have to do an exercise that works for your body. In other words, a personalized approach. So not just there's one diet that fits all, there's one exercise that fits all. It's more tailoring a program for what the patient needs. So obviously, an 80-year-old grandmother needs a totally different herbal, vitamin, and exercise regime than somebody who's a 20-year-old football player. And so what I want to say is that it's important to exercise. We also have to remember to pace ourselves. So exercise, even though you do have chronic fatigue syndrome or long COVID, is very, very important as part of the recovery. Regina, a restaurant owner, lost everything during the pandemic. She tried to keep the business afloat by processing takeout orders and occasional catering, but it was not enough. She had to lay off everybody but the cook and herself. And at the same time, her husband had to go to Kansas to care for his father, who had COVID-19 and was in a nursing home, and his mother, who was elderly and not doing so well. While this was going on, her son and college was ending because of the pandemic. Her son Gary came home, and after a couple of days, he started going out to party with his friends. He was bored with online classes, and his friends were home from school too, so they all went out at night. Well, a few days later, Regina's mom, who was a diabetic with heart disease, began feeling ill. She was coughing the whole night, and she had a crushing pain in her chest. And Regina found her mother in the fetal position, and her lips were blue. She was extremely pale. And so Regina tried to bundle her mother up in a blanket and take her to the car, but her mother was too weak. So she called 911 and waited 3 hours for an ambulance. And When Regina's mom got in the hospital, she was placed on a ventilator. She had severe acute COVID-19. About a week later, she was ready to expire, and Regina had to say goodbye to her mother by FaceTime. She was so mad at her son. She goes, how could you do this to me? You killed your grandmother. You were partying and you didn't have any symptoms, but how could you do that? And Gary was, a teenager. He didn't really know what to say because he didn't have any symptoms. He didn't think he could kill his grandmother. So he left home for about a week. At that point, Regina was ill with COVID-19 herself. All she could do is pretty much keep herself going. Eventually, her son Gary came back with his uncle, and they expected to just come back to Regina's house. Regina laid down the law. She said, no smoking, no drugs, no partying. The first night, Uncle and Gary were on their best behavior. They helped her clean up. And the following night, they were also on their best behavior. But on the third night, that's when the partying began. And so they started going out at night. Regina was dealing with really severe acute COVID. She really didn't know what to say. She just hung out in her bedroom and slept, but tried to sleep most of the time. And then one day, all of a sudden, it was about 8 p.m., and her house began filling up with people. She was alone in the bedroom in bed, and she was so disappointed because she remembered telling Uncle and Gary no parties. And then when she heard, "Cheers!" her heart just sank. She spent about an hour or two just fuming, like, how could Gary and Uncle do this to me? I told them no drugs, no alcohol, no parties. You're totally disrespecting me. So finally, when the party went on for a few hours, she got up and yelled, "Everybody out!" Yet the noise was so loud, the music was screaming, that nobody even paid any attention. So she went back into her bedroom, called up her daughter, and she and the daughter, a couple days later, changed the locks and threw out Gary and the uncle. When Regina changed the locks and threw her son out of the house, she went into a deep depression. So she was dealing with COVID symptoms. She was also dealing with depression. Her COVID symptoms were mainly brain fog and severe fatigue, also insomnia. But luckily, her daughter was a healer. Her nurse daughter recommended SAM-E, the nutritional supplement, and also melatonin to help sleep. The other thing that the daughter recommended was to see a therapist. And the therapist that Regina saw specialized in EMDR, which is a type of trauma reprocessing. The therapist also recommended that Regina exercise her mind by using puzzles and online classes as a way of stimulating her mind to combat brain fog. And then the therapist also recommended light exercise. So Regina dusted off an exercise bike that hadn't been used in years and started pedaling indoors 5 minutes a day, and then 10 minutes a day, and then 15 minutes a day, and then 20 minutes a day. And by the time she was cycling at home 20 minutes a day, she was basically cured of her long COVID. Ray called me up after being exposed to COVID-19 at his mother's nursing home in Brooklyn, and he wanted to know what natural remedies worked for COVID-19 in addition to vitamins and zinc that he was taking. And I recommended some herbs. The second time Ray got COVID-19, he was exposed by a patient, and he developed terrible symptoms. He had really bad coughing. He felt like he was burning up with fever. He didn't have control of his bowels. Luckily, his wife, Linda, was a nurse, hooked him up to an IV and used vitamin C. And after 3 days of the intravenous vitamin C therapy, he felt better for a while, and then all of his chronic Lyme disease symptoms got triggered. And he began to have very strange sensations in his body. And there was an electrical current running through him that felt like he was radioactive. And he had this knee pain. It was an old athletic injury, and it was just causing excruciating pain. Ray had to use a very complex regime of standard medicines, orthodox medicines, and natural medicines, in other words, to cure his long COVID. Well, when Ray was in his 20s, before he was a medical doctor, he liked to travel, and he traveled widely in South America and Asia. And unfortunately, he got severe gastrointestinal infections and actually ended up in the hospital. And one of the reasons he became an integrative physician, Western doctors were not initially able to diagnose his infection. He didn't necessarily respond to all the treatments. Before he became a holistic doctor, he reached out to a holistic doctor and got treatments. And that opened up a whole world to him, and so he decided to specialize in integrative medicine, and he eventually opened a clinic with his wife, Linda. Now, in addition to going to his mother's nursing home, he was practicing back at home, and then he got infected, and basically Ray had to close his practice. Ray continued to see clients by Zoom. But the important thing for people that when they develop conditions like chronic fatigue syndrome and long COVID is they have to pace themselves. Because I had recently been diagnosed with chronic fatigue syndrome, I'm the same way, I have to pace myself. So with Ray, it involved closing his practice and seeing patients for 2 hours and then taking a break for 2 hours. In addition, he needed a lunch siesta, and then he usually basically just relaxed in the evening. He used to see patients in the evenings. Now he just relaxed. And in my own case, having chronic fatigue syndrome means that I really can't drive after 5 o'clock. So I got together with a friend, and I had to say to my friend, if you'd like to see me, you're going to have to drive me, because I can't drive after 5 o'clock. One of the ways that we heal is we give ourselves enough time to heal, and that's part of the natural healing process. Another important part of the natural healing process is our symptoms are one of the ways that our body communicates with us. I saw something really fascinating on TV. These people were regular people who volunteered to put themselves in a prison. And the reason that they volunteered to put themselves in a prison is to help the warden basically find out where the illegal drugs, how they were getting smuggled and things like that. And these were all good doer people. It was a week before going to prison. All the subjects were in a conference room, and the sheriff and his deputy were 12 feet away. Yet there was one guy, and Andrew was this guy, who was just shaking like a leaf. But there was no danger. The sheriff was a non-threatening person, and he wasn't in trouble, and he was 12 feet away. And so the sheriff said, "You're not even in prison. Why are you shaking?" And I told this to a friend. My friend said, "Geez, I don't know why somebody like Andrew would shake in that situation. It's because my body was trying to communicate." And I really had a lot of empathy for that person. His body was trying to say, "Dude, you should never think about going into prison. You just don't have the fortitude to stand it," right? But he didn't listen to his body. He ended up going to prison and almost having, as a volunteer, as a good do-gooder, he almost had a nervous breakdown, and he had to get them to take him out of prison. So the reason I tell you that story is the body can't say, "Hey, Andrew, stop. Hey, Andrew, you have long COVID. Hey, Andrew, you have chronic fatigue." The body can't do that. It can only produce symptoms, and it's up to us to interpret those symptoms. So Ray is a physician, and so he diagnosed himself with having long COVID. And the treatment was not easy. He took a combination of nutrients, IV, as well as by mouth. He also used pharmaceuticals, and he also used herbal medicines. And one thing that has been very important for Ray over 20 years is his meditation practice. I believe he practices Vipassana meditation. The other thing that he learned during the pandemic is learned how to cook. His mind was not there fully because of brain fog, but he had time, and so he thought, I've always wanted to learn how to cook. And so cooking actually was relaxing to him. It helped engage his senses. And it's also a way he could contribute to his family by cooking meals. Many people try to treat themselves and they find it really doesn't work. And again, that's because they are not experienced with treating other people, and also because, again, chronic fatigue syndrome and long COVID are complex conditions and they don't respond well to one pill, one disease type solution. If you can't afford or are unable to find a natural doctor to work with, you can be your own healer. It just makes it more difficult, because one of the things that people find it difficult is separating the forest from the trees when they're treating themselves. And I find it hard to treat myself. So even though I'm a healer with 35 years experience, I have an integrative physician that helps me with the chronic fatigue syndrome. And it's because it's important to get a wider frame reference.
It's Andrew. The idea of integrative or functional pharmacy is a big part of what we do, because this type of pharmacy really lends itself really well to this functional or integrative medicine approach. When I started really getting into this type of medicine, and really what brought me into this was the area of hormone replacement for women and men, and kind of looking at the research around that and kind of seeing how the mainstream wasn't guiding people to the best therapies based on what the research was saying. That kind of just started me on this journey of learning more and more about different ways that we can support healthy aging or chronic conditions with more elegant approaches that really targeted the specific disease processes. This got me really excited because it was the first time in my career when I started dispensing medications to people that they would come back and they would say, oh my gosh, that medication transformed my life. I feel so much better. I've been dealing with this problem for 20 years and now my brain fog has lifted, or my energy level's up, or I'm not in pain anymore. And I'd never had that experience dispensing medications out of a traditional pharmacy for the first 10 years of my career. And I'm not saying that I didn't help people. I'm sure those medications had some value, but it wasn't the dramatic transformation of people's health that I saw when we started getting into this area of medication. Well, certainly long COVID's an emerging area that we're really working on, and there's a lot of emerging understanding about what's happening with patients with long COVID and why certain patients are experiencing long COVID and other patients are not. So I think in a lot of cases we're going to get more clarity on this as we go. But to me, the idea of fibromyalgia, chronic fatigue, a lot of these conditions to me relate back to the immune system. And when I think of immune system, I think of gut health, the gut-brain connection. It's connecting all these pieces. You can go to a gastroenterologist or an immunologist or a rheumatologist, and they're all going to see different pieces of this. But what we really want to do is start connecting those pieces, because in the body, they're not distinct. They're communicating with each other all the time. And one of the things that's extremely clear to me in these types of conditions is that the immune system's hyperactive, especially we know that was true with long COVID. It's causing a lot of symptomatology. The first place we want to look at is gut health, because we know that that's the initiation point for the most part for immune stimulation. And what's interesting about that is a lot of that's not drug stuff. That's diet, hydration, stress management, things like that. We do have some tools as well that can help, that are prescription type things like low dose naltrexone, which is a really important tool in helping reset the immune system. So that's something we use for lots of different autoimmune conditions, and there seems to be an emerging role for that therapy in things like long COVID. We also are just trying to find tools to treat symptoms of long COVID, because people present really differently. Some people have tinnitus, some people have brain fog. So we also are trying to, kind of address those symptoms to really return them back to functioning. So we have something that's a nasal spray called Synapsin, which is like a neural anti-inflammatory that's really great for conditions where people have a lot of brain fog and there's a lot of inflammation going on in the brain. It's a nasal spray that has some herbal ingredients basically. It's not even really a drug, but it works very efficiently at kind of helping shut down or quiet down that inflammatory response. in the brain. So these are types of things that, again, kind of personalized medicine, getting individual about this, finding out how somebody's presenting with a certain condition, and then trying to come up with some of the best options we have, and then follow up and see if it's working and keep going from there.
Although it's been like a slow process, there are a few mushrooms that kind of are stand out that have been used for probably 10,000 years since the first use of mushrooms by humans. The earliest mushroom for cultivation is probably the shiitake mushroom throughout China. And they knew that, well, it is a high source of protein. It also has a lot of fiber to it. Very hardy mushroom, but it also has antiviral properties and kind of anti-inflammatory. Reishi mushrooms are a little bit harder to come by. It's a little harder to consume because it is something that has to be broken down and made into teas. It is known to like reduce tumor size. Turkey tail is a mushroom that we predominantly harvest wild. We find it throughout Northern California, and we're finding that a lot of the research now is focusing in on turkey tail as being wonderful for kind of like long COVID and COVID symptoms for upper respiratory. And all mushrooms are an adaptogen, or have, like, most of the medicinal mushrooms are adaptogens, so that they not just allow your immune system to fight certain viruses, but it just gives you what your immune system needs to fight those. So it doesn't say that it's good for hepatitis or tuberculosis. It just gives you your immune system whatever component it needs to fight that off. It allows it to kind of regulate itself to a certain degree.
And now we're going to talk about some remedies used for chronic fatigue syndrome and long COVID. The first one is aromatherapy. So we want to remind ourselves that herbs can be taken topically as well as internally. And I'm placing my aromatherapy over a famous acupuncture point for nausea and vomiting. The next is a superstar for long COVID and chronic fatigue syndrome, and it's called glutathione. And I take glutathione in liposomal form. Liposomal helps it integrate into the body better. I hold it in my mouth for about 30 seconds before I swallow. Now, glutathione is anti-inflammatory, energizing, promotes the immune system, and helps build glutathione in the body. It's also useful for liver detoxification. And like I said, it's my number one choice of a remedy for long COVID or chronic fatigue syndrome. Glutathione can be built up by using liposomal glutathione, taking the supplement NAC, or by taking whey protein. So every day I take whey protein in my smoothie. It's good to take about 20 to 25 grams a day. Again, it could be just mixed into a smoothie. I have a friend who mixes it into his tea every morning, so it tastes pretty neutral. The next one I want to talk about is saffron. And saffron is one of the most beautiful ingredients, and also it's one of the most promising in terms of a food, a dietary supplement, and as a medicine. And it's predominantly used for brain health. The next one, which has a very similar color, I take these gummies with phosphatidylserine, oftentimes abbreviated as PS, and this is a great ingredient for brain fog and brain health, and also mental fatigue, energizing the body. And I find this formula effective within about 5 or 10 minutes. Probably my second most recommended supplement for long COVID and chronic fatigue syndrome is the supplement SAMe. It's a type of methionine. It's actually been used for 30 to 40 years in the United States and Europe as a treatment for chronic pain, depression, and also brain health and immune benefits. So SAMe is one of the best ones. And several of my patients with long COVID, such as Regina, found that SAMe was very effective, sometimes within a few days after taking it. Next, I want to talk about CoQ10. and this is also known as coenzyme Q10. This is an ingredient that is very good for cardiovascular health, good for immune health, and also supports the body's energy system. I like CoQ10. I like the chewable type, so I actually take a chewable type of CoQ10 and find that very energizing. Use chewable so it absorbs better into the system. One of the key take-home messages, though, about CoQ10 is that there are some brands, particularly the cheaper brands, that are not absorbable. And so the dosage of CoQ10 is very, very crucial to getting results. And so that's why I recommend using CoQ10 and these other remedies under a health professional's guidance. And the final one I want to talk about is my old friend ginseng. This is not a fancy ginseng root. This is a real ginseng root that I take. And ginseng is one of the best herbs for replenishing the body's energy system. What I want to tell you is that ginseng is actually very complicated. It really needs to be taken with other ingredients to get the most effectiveness. And so although I take ginseng almost every day, it depends upon my signs and symptoms as to what herbs I combine it with. There's all sorts of grades of ginseng, and an herbalist or health professional could perhaps tell you what the best value for the buck in ginseng. So ginseng root is the best way to go, but then obviously there are powders and pills, and I don't recommend that as much as the whole ginseng root. So there's three things I want you to remember. Number one, find a healer, even if that healer is you. Number two, embrace self-care. And number three, remember that health is not in a straight line. Embracing self-care is really about acknowledging the fact that you do the best you can with the resources that you have. And number three is remember health is not in a straight line. That's because we wish, we pray that when we start to take medicine, that we just get better and better and better. But the reality is we often make progress, we slip, we make some progress, we slip back, and we make some progress, and then we make some more progress. And then we get better and better and better. And one of the more inspiring cases is my colleague Michael. And Michael had all the full-blown long COVID symptoms.
Probably the first symptom that I had was the fainting. We now know that there is postural hypotension, which means that the blood pressure becomes unstable, whether you're laying down, sitting, or standing up, which has now been attributed to the COVID virus.
And again, he searched out natural alternatives because the Western doctors couldn't help him.
At a certain point, taking advantage of all the tools that are out there and finding ones that are correct, but not necessarily all of them at the same time.
And by doing stress reduction, exercise, taking herbs and nutrients, after many months, he was able to go to India. So there's a lot of hope if you have long COVID or another long haul condition.
I think the idea of that we don't get overwhelmed and we take care of what we have within our sphere of influence and not overly worry about things that are out of our control, because all that does is disempowers us from being able to act on the things that we can act on. So we have to take care of ourselves first. And I think in whatever way we can do that, I think that's really critical.
I hope you'll find and work with a practitioner and remember to not get discouraged. An old doctor I worked with once said, in healing, if you can go 2 steps forward and 1 step back, you're making progress.